Many people believe that aging well depends on luck, or family history, or doing everything perfectly. But in reality, aging often tells its story more quietly than that. Sometimes, the most important signals are not the problems we notice. They are the problems that never appeared. The conditions that did not slowly take hold. The issues that did not quietly limit daily life. As we move past 60, the body changes. Not suddenly, not dramatically, but gradually, over many years. And during this time, certain common conditions tend to shape how independent we remain, how steady our energy feels, how comfortable everyday movement becomes. This video is not about diagnosis, and it is not about predicting the future. Instead, it is about awareness, about understanding patterns that often appear with age, and about recognizing which health changes deserve calm attention rather than fear. Many older adults feel mostly well. They continue their routines. They stay active in familiar ways. Yet some conditions can develop quietly in the background, influencing balance, circulation, breathing, or energy long before they are clearly noticed. By understanding these patterns, we can have more informed conversations with ourselves, with family, and, when needed, with health professionals. This is not about avoiding aging. It is about supporting independence, preserving dignity, and staying connected to daily life for as long as possible. In the next part, we will begin by looking at the first disease that often shapes long-term independence after 60, one that many people underestimate, simply because its early signs are easy to overlook. The first disease to be aware of is one many people already recognize: heart disease. If you have reached your 60s without being diagnosed with heart disease, that is worth noticing. Not as a guarantee of anything, and not as a reason to become careless, but as a quiet sign of how your body has been managing over time. The heart does more than pump blood. It supports daily energy. It influences balance and endurance. And it plays a role in how clearly the mind feels throughout the day. When the heart is working steadily, everyday life often feels easier to manage. Walking requires less effort. Tiredness does not linger as long. Recovery after activity feels possible, even later in life. What makes heart disease challenging is not only the sudden events people fear. It is the slow changes that often happen quietly, over many years. This condition usually does not announce itself loudly. Blood vessels may slowly stiffen. Pressure may rise gradually. Circulation can become less efficient without causing immediate discomfort. Many people continue their normal routines during this time. They still feel mostly well. They stay busy. They adapt, often without realizing anything has shifted. That is why heart disease is often overlooked in its earlier stages. Reaching later life without it often reflects small, steady habits repeated over time. Not extremes. Not perfection. But regular movement. Simple, balanced eating. And allowing the body enough rest to recover. Stress also plays a role here. Not the occasional worry, but tension that never settles. When the body remains in a constant state of alert, the heart carries that burden year after year. This does not mean stress can be avoided completely. Life always brings challenges. But it does suggest that learning to pause, unwind, and recover matters more than many people realize. Even so, heart health remains something to stay aware of. Changes can still appear later in life. Sometimes quietly. Breathlessness that feels new. Fatigue that lasts longer than before. Or a sense that everyday tasks require more effort than they once did. These are not conclusions. They are observations. Because when the heart struggles, independence often becomes harder to maintain. Energy narrows. Confidence can slowly fade. Daily life begins to feel more demanding. The absence of heart disease is not about medical charts or numbers. It is about how supported everyday living feels. And it is only one part of the larger picture. In the next section, we will look at another disease that often develops just as quietly, one that affects how the body handles energy and balance throughout the day. The second disease to be aware of is one that often develops quietly over time: diabetes. If you have reached your 60s without being diagnosed with diabetes, that is something worth noticing. Not as a guarantee, and not as proof that nothing can change, but as a sign that your body has maintained balance for many years. Diabetes is not only about sugar levels. It is about how the body manages energy, how it responds to food, and how well different systems communicate with one another. This disease usually develops gradually, often long before it is formally identified. This condition begins when the body becomes less responsive to insulin. Energy that should move smoothly into the cells starts to linger in the bloodstream instead. Over time, this affects circulation, nerves, vision, and even how clearly the brain functions. What makes diabetes especially challenging is how easily it blends into everyday life. People often feel mostly well at first. They adjust without realizing why energy dips more often, or why recovery takes a little longer than it used to. Avoiding diabetes into later life often reflects long-term patterns rather than strict rules. Regular meals, moderation with sweet foods and drinks, and staying physically active in ordinary ways. Walking, gardening, moving often, rather than intensely. Rest also plays a role. Poor sleep affects how the body processes sugar. So does ongoing stress. When the body remains under constant pressure, it struggles to regulate balance. And over time, that imbalance can quietly settle in. This does not mean everything must be controlled. Life is never perfectly predictable. But it does suggest that consistency often matters more than restriction. Even later in life, awareness remains important. Changes can still occur, sometimes slowly. Feeling unusually thirsty, needing to urinate more often, or noticing blurred vision or persistent fatigue. These are not conclusions. They are signals worth paying attention to. Because when diabetes is present, independence can become harder to maintain. Energy fluctuates. Circulation slows. Daily routines require more planning and effort. Staying free from diabetes for many years often supports steadier energy, clearer thinking, and greater confidence in daily life. If you're still listening with me at this point, it suggests this topic matters to you. You don't need to respond in any particular way. But if you feel like it, leaving a short comment can help this conversation continue. And if calm, practical discussions like this are useful to you, you're welcome to subscribe and join us again. Diabetes is only one part of the picture. In the next section, we'll look at another disease that can change life suddenly rather than gradually. One that affects circulation and the brain, and often arrives without warning. The third disease to be aware of is one that many people fear, often because of how suddenly it can change daily life. Stroke and circulatory disorders. If you have reached later life without experiencing a stroke or a serious circulation event, that is worth recognizing. Not as a promise of safety, and not as something to take for granted, but as a sign that blood flow to vital organs has remained relatively steady over time. A stroke happens when blood supply to part of the brain is disrupted, sometimes by a blockage, sometimes by a weakened vessel. What makes stroke especially challenging is not only the event itself. It is what can follow. Changes in movement, speech, memory, or balance. Even a small disruption can affect independence in lasting ways. Circulatory disorders often develop quietly long before any major event occurs. Blood vessels may gradually lose flexibility. Pressure may rise without obvious symptoms. Circulation can slow, especially to the brain and limbs. This condition rarely causes pain at first. Many people continue their routines. They adapt. They compensate. That is why circulation problems are often overlooked. Reaching your 60s or 70s without a stroke often reflects long-term care of the vascular system. Not through extreme measures, but through everyday patterns. Regular movement that keeps blood flowing. Periods of rest that allow recovery. And habits that avoid placing constant strain on the system. Emotional stress matters here as well. Ongoing tension narrows blood vessels. It keeps the body in a state of pressure rather than ease. Over many years, that pressure accumulates. This does not mean stress can be eliminated. Life always includes challenges. But learning to settle the body after stress, to pause, to breathe, to let tension pass, can quietly support circulation in powerful ways. Good circulation supports more than the brain. It affects muscle strength, balance, warmth in the hands and feet, and how quickly the body recovers after effort. When circulation is steady, movement feels more confident. Reactions feel sharper. Everyday activities feel less demanding. Even so, awareness remains important later in life. Sudden dizziness. Unexplained weakness on one side of the body. Changes in speech or vision. These are not conclusions. They are signals that deserve calm, prompt attention. Because when circulation to the brain is compromised, independence can change very quickly. And that is why this disease deserves quiet respect. Avoiding stroke for many years often allows people to remain themselves. Clear in thought. Steady in movement. Present in daily life. But circulation is only one piece of the overall picture. In the next section, we'll look at another disease that works differently. One that develops at the cellular level, often silently, and can affect many parts of the body at once. The fourth disease to be aware of is one that many people associate with fear, often because it feels unpredictable. Cancer. If you have reached later life without a cancer diagnosis, that is something worth acknowledging. Not as a guarantee of the future, and not as a reason to stop paying attention, but as a sign that your body has maintained a certain level of internal balance over time. Cancer is not a single condition. It refers to changes in how cells grow, divide, and repair themselves. Every day, even in healthy bodies, abnormal cells can appear. Most of the time, they are identified and cleared away quietly. That is the immune system doing its work in the background. As we age, that process can slow. Repair systems become less efficient. Inflammation may linger longer than it once did. What makes cancer challenging is that it often develops silently. There may be no discomfort at first. No clear changes in daily routine. No immediate reason to be concerned. Many people continue their normal lives while these cellular changes take place. They feel mostly well. They adapt. They assume any tiredness or change is simply part of getting older. Avoiding cancer into later life often reflects a combination of factors. Some are outside personal control. Others are shaped slowly by daily choices. Long-term exposure to smoking or excessive alcohol matters. So does chronic stress that never truly settles. And so does ignoring changes in the body because they seem small or inconvenient. What often supports cellular health is not extreme behavior. It is consistency. Eating a varied, simple diet. Allowing time for rest and recovery. Spending time outdoors. And maintaining social connection, which supports immune balance more than many people realize. Paying attention also plays a role. Noticing changes early. Keeping up with routine checks that are appropriate for age. and responding calmly rather than dismissing concerns. This does not mean living in constant vigilance. It means staying connected to your own body. When cancer does appear, it often affects more than physical health. It can disrupt confidence, independence, and a sense of stability in everyday life. That is why awareness matters. Not fear, not prediction, but quiet attention. Reaching older age without cancer often allows people to maintain rhythm in daily life. Energy feels more consistent. Recovery feels more possible. And independence is easier to preserve. Still, cancer is only one part of the picture. If this part gave you something to think about, that is enough. There is no need to respond in any particular way. Some people prefer to reflect quietly. Others find it helpful to share a short thought. If you feel comfortable, you're welcome to leave a brief comment below. And if these calm conversations about aging and everyday health are useful to you, subscribing simply means you can continue listening along in future videos. Cancer affects the body at the cellular level. In the next section, we'll look at another disease that works differently again. One that affects breathing, energy, and how comfortably the body moves through daily life. The fifth disease to be aware of affects something we often take for granted. Breathing. Chronic lung disease. If you have reached later life without chronic breathing problems, that is worth recognizing. Not as a sign of perfection, and not as something guaranteed to last forever, but as an indication that your respiratory system has remained relatively resilient over time. The lungs supply oxygen to every part of the body. When they work well, the heart does not need to strain as much. The brain stays clearer. Energy feels more stable throughout the day. Chronic lung disease often develops slowly, sometimes after years of irritation from smoke, pollution, or repeated infections. Other times through reduced movement and shallow breathing patterns that quietly settle in with age. This disease does not always arrive with dramatic symptoms. Breathing may feel slightly shorter. Recovery after exertion may take longer. Climbing stairs may feel more demanding than before. Many people adjust without realizing what has changed. They sit more. They move less. They avoid activities that leave them breathless. Over time, this can quietly reduce independence. Avoiding chronic lung disease into older age often reflects everyday habits rather than deliberate training. Regular movement that encourages deeper breathing. Spending time outdoors when possible. And avoiding environments that irritate the airways. Posture also matters. When the chest is collapsed for long periods, lung capacity gradually reduces. Standing tall, stretching, and allowing the ribs to expand can quietly support breathing over time. Hydration plays a role as well. So does allowing the body enough rest to repair tissue. Strong lungs support more than physical comfort. They support confidence, the ability to move freely, and the freedom to engage in daily life without constant limitation. When breathing feels easy, independence feels possible. Avoiding chronic lung disease allows people to walk, talk, laugh, and rest without effort dominating every moment. And that makes a meaningful difference to quality of life as we age. When we look at these 5 diseases together, a pattern begins to emerge. Heart disease, diabetes, stroke and circulatory disorders, cancer, chronic lung disease. These are not rare conditions. They are common patterns that tend to shape how independent life feels after 60. Reaching later life without them does not mean someone has done everything right. And it does not promise anything about the future. But it often reflects years of balance. Small choices repeated over time. Moderate movement. Simple eating. Periods of rest. And ways of handling stress that allow the body to recover. Healthy aging is not about chasing youth. It is about supporting function. The ability to move comfortably, to think clearly, to breathe easily, and to remain engaged with daily life. Independence is not measured by age alone. It is felt in everyday moments. Getting out of a chair without hesitation, walking without fear, waking up with enough energy to face the day. Awareness of these diseases is not meant to create worry. It is meant to support attention, because understanding how the body changes allows for calmer decisions, more informed conversations, and a greater sense of control as we age. Longevity is not just about how long life lasts. It is about how life feels, year after year. Before we finish, take a moment to notice what stayed with you from today. There is no right response. If one thought or reminder felt meaningful, you're welcome to share it below. This space exists so we can learn quietly from one another. And if these calm conversations about aging, health, and daily life are helpful to you, subscribing simply means you can continue listening along in future videos. Thank you for spending this time here.